Welcome to Friday's edition of COVID-19. There's been a slight jump yet again today in our daily cases, and given the growing presence of variants on the local front, authorities have decided to extend current prevention measures for 2 more weeks. Our Kwon So-ha has details in a bit, and we also bring you the latest on the lingering after effects of the virus later on in the program with our panel of experts. First then, So-ha, do start us off, that is, with the figures for this Friday.
Sure, Sunny. We're seeing a slight rise in cases this Friday with 488 infections reported as of 12 a.m. And with that, we're also seeing a slight increase in domestic transmissions, which are now standing at above the mid-400s, with 21 imported cases, that figure remaining unchanged from yesterday. And the total number of accumulated cases here in Korea stands at 94,686, and 10 people have lost their lives in the past day, raising the death toll to 1,662. And we're seeing quite a large number of recoveries this Friday, over 1,000 people who made a full recovery of the virus. Now, around 70% of Friday's cases, that's a little over 330 infections, were confirmed in the metropolitan region. And we're also seeing a surge here in Gyeongsangnam-do province with a cluster infection at a bathhouse, and also here in Jeollanam-do province with 4 cases. Here, the total has now hit 900.
I see. And so, as I mentioned at the start, COVID-19 prevention guidelines have been extended yet again.
Right, Sunny. Social distancing measures will remain at level 2 in the metropolitan region and level 1.5 elsewhere. And also, the ban on private gatherings of 5 or more people will stay in place. And they were originally set to be taken in effect until Sunday, but have been now extended for 2 more weeks, which means until March 28th. Now, officials stress that daily cases have been ranging in the 300 to 400 level for 8 weeks now. And in the past week, the average of domestic infections stood at 418. And in fact, in the past week, we are seeing that 400s have been outnumbering the 300s. And with that, officials are saying that they will take stronger efforts to contain the virus. Let's take a listen.
We will designate the next 2 weeks as a special review period to inspect prevention measures at public use facilities. That will include wide-scale COVID-19 testing at confined workplaces where foreign laborers are employed.
Let's also get a check on the vaccination process. Over 546,200 vaccinations have been completed here in the nation, with some 42,500 inoculations on Thursday. And on to the international news. In an address marking a year since the pandemic was officially declared, U.S. President Joe Biden condemned anti-Asian hate crimes, which reportedly more than doubled amid the pandemic last year in 16 major U.S. cities. And he says that such acts are un-American and must stop. Let's also take a look at the numbers abroad, and let's start with the U.S., which is now approaching 30 million infections. And also there are many concerns here in Brazil with resurgences due to variants. The same concern in European countries like France, Italy, Germany, and also the Czech Republic. Our Song-yeon is going to go into the details on the variant situation there. And last but not least, let's take a look at the total number of infections around the globe, which stands at 119.1 million, with a similar rise in cases compared to yesterday. And those are the updates I have for now. We have no afternoon briefings on Friday, so I will see you back on Monday. Back to you, Sunny.
All right, so thank you. Have a good weekend.
You too.
Right, now we take a closer look at the latest events on the coronavirus variants across the world. I have Kim Song-yeon here in the studio with me. Welcome, Song-yeon.
Hello, good afternoon.
Right, let's begin with findings that show the UK variant is more fatal, I think.
Right, that's right. According to this study, the UK variant, like you mentioned, it does have a significantly higher death rate. New research announced on Wednesday showed that the UK variant may be twice as deadly as other variants circulating in the UK, underscoring concerns about how mutations may change the characteristics of the disease. Now, the study published in the British Medical Journal found that the strain first found in Kent is between 30% and 100% more deadly. The study study also found that the viral load appeared to be higher for the variant, making it more infectious and causing more serious illnesses. The study's lead author, Robert Challen from the University of Exeter, said that death from COVID-19 is still a rare event, but the B.1.1.7 variant raises the risk. And the researchers also said it is about 40 to 70% more infectious than earlier variants.
Right. And I believe this particular variant, the UK variant, is crippling medical centers across Europe.
Right. Several regions within Europe, they're witnessing rebounding caseloads. And this is particularly due to the more infectious UK variant. For instance, in the Czech Republic, data from January showed between 45% and 60% of new patients were infected with the UK variant. The Czech Republic has ranked among the European countries worst hit by the pandemic, and a hospital in the eastern part of the country had its COVID-19 wards filling up until more than 20 new arrivals just on Monday alone were too much for the hospital to handle.
We took in 22 patients on Monday alone, and that was beyond our capacity, so we had to seek outside help.
On Tuesday, ambulances took 15 patients to hospitals as far as 230 kilometers away, as the ones nearby were full. The director added that they had been close to reaching their capacity for the past 2 weeks as well, and they have reached it several times. The situation is much the same for other European countries, including Germany, France, and Italy, where hospitals are also under great pressure.
Sonia, this particular variant also counts for more than a quarter, is it, of all new cases over in Europe then?
Right, 1/4. The UK variant is spreading rapidly, quickly in major European nations. The major outbreaks are being reported in 27 European countries monitored by the WHO. And it is the dominant strain in at least 10 by the agency's count, including Britain, Denmark, and Germany.
Just like in other countries, the transmission rate of the variant is doubling on a weekly basis. The UK variant is likely to soon become the most dominant strain in Germany.
Other experts in Germany also noted that the variant will indeed soon become the country's dominant strain, making it even more difficult to keep the virus in check because it is both more infectious and more deadly across all age groups. And the UK also is certainly not out of the woods, even though deaths are falling and the vaccine rollout is going well over there. The UK government's chief scientific advisor, Patrick Vallance, said the situation could quickly deteriorate with the new variant.
Roughly 10 would be expected to unfortunately die with the virus. With the new variant, for 1,000 people infected, roughly 13 or 14 people might be expected to die.
The UK variant is now present in some 100 countries and territories, including here in Korea. In fact, since last October, the UK variant has caused 154 infections here in Korea, taking up the majority of all other cases linked to new COVID-19 variants. Now, this compared to 21 cases linked to the South African variant and also 7 to the Brazilian variant.
Right. And speaking of the Brazilian variant, Sangyan, authorities in Brazil, I hear, are struggling to contain a second wave that is threatening the stability of the country's medical infrastructure.
Yes, the situation is not looking so bright over there. A new variant of the Brazilian variant is spreading throughout the country, and it's a second wave indeed. It's ripping throughout the country, pushing hospitals and ICUs to the brink of collapse and claiming record numbers of daily deaths as well. Now, with Brazilian hospitals overloaded and government officials divided over lockdown measures, the country has few defenses against the variant that may be even more contagious. A preprint of a new modeling study by researchers in Brazil and the UK suggests the variant first detected in the northern city of Manaus late last year, known as P1, may be up to 2.2 times more transmissible. And the study, which has not yet been peer-reviewed or published in a medical journal, suggests that even people who have already had the coronavirus could be vulnerable. The same study showed that the P1 variant could evade immunity from from previous infection by up to 61% as well. And that variant is now prevalent in coronavirus patients across at least 7 Brazilian states. Now, P1 has also been detected in the US, UK, and the neighboring Venezuelan country. In the meantime, back here in Korea, new emerging foreign variants are also affecting the country. Korea has detected a total of 75 cases of emerging variants since December of last year. And the KDCA said these variants are different from the 3 most well-known mutations from the UK, South Africa, and Brazil. But there is no indication yet whether these new variants are deadlier than the currently circulating variants. Now, of the total, 21 are arrivals from the US, 2 from Mexico, and 45 were locally transmitted. Also, 68 of them are cases of the variant first identified in California and has been circulating in the region since December.
All right, Song-yeon, as always, thank you very much for that coverage.
Thank you for having me.
Right, we are marking 2 weeks since the launch of our inoculation drive, and efforts to ensure a safe vaccination campaign have been broadened to include personnel from Seoul's fire and disaster headquarters. Our Chun Song-cho is out on location to tell us more. Hello, Song-cho.
Good afternoon, Sunny.
Now, Song-cho, as always, do start by telling us where you are then.
Yes, so I'm at the National Medical Center, or the NMC, in central Seoul. This is actually where the country's first vaccination center was established last month in order to kickstart and pick up steam with the country's biggest immunization drive ever in history. And ever since then, throngs of people who are eligible for vaccine have been coming here to get a shot in their arms, and today's no exception. As you can see, there are many people who are constantly getting inoculated here. But with much of the population really keen on developing immunity against the vaccine, against the virus that's responsible for disrupting so many people's lives and work on an unprecedented global scale, some are still kind of skeptical or even on the fence about the safety of the vaccine or about getting the shot in their arms as well. So in order to quell any uncertainties or anxieties over the safety of the vaccine, the Seoul Metropolitan Fire and Disaster Headquarters dispatched a 119 rapid response team here at the NMC in order to help up with the vaccination program here. So right behind me, you see some of the officials in orange top. They are the first responders from the rapid response team. So here is where people will get examination to check up on their health condition, if they're in the right condition to get the vaccine. And these stations are where people are getting inoculated, and this is where they are getting the vaccine into the syringe. So, but remember, the first responders are only here for an emergency situation because some of the times patients can develop severe reaction or side effects after getting the vaccine. In that case, people will be put into the room right here. This is the emergency room, and the first responders will come here for some first aid measures. But sometimes they have to move to a bigger public medical facility. In this case, it's just right next door, 2 minutes away by ambulance, because sometimes they have difficulty breathing and they need to perform some CPR or other kinds of first response measures. But also the team members are also in charge of other rapid response measures they are more used to, for instance, like a fire suppression or evacuation, in order to really contribute to the center's general fire safety. So why don't we delve into what the team is doing here at the center and talk to one of the officials. 안녕하세요. 안녕하세요. 네, 안녕하세요. So I'm going to ask her what's it like working here, because obviously this is not the typical work setting that they're used to. 네, 그래서 여기 센터에서 일하시는 게 정말 흔하지 않은 일이실 것 같은데 어떤 마음가짐으로 업무에 임하고 계신가요?
네. 그 코로나19 감염병 재난으로부터 우리 국민의 생명을 보호하고 또 일상의 행복을 되찾아드리기 위해서 그 접종자 한 분 한 분을 정성으로 대하며 책임감을 갖고 일하고 있습니다.
All right, so since vaccination is essential in the fight against COVID-19, in order to really save people's lives and help them get back to their normal lives, they're fully committed to helping the program run as smoothly as possible. 그럼 혹시 여기 구급차가 있다고 들었는데 한번 볼 수 있을까요?
네, 이쪽으로 오세요.
네, 감사합니다. So I asked her if we can take a look at the ambulance, which is parked right outside the center. So, like I said, if patients post-vaccination show severe side effects, then they will be moved and transported on this ambulance. 그러면 혹시 안에 소개 좀 부탁드릴게요.
네. 그 이제 주로 호흡곤란 환자들이 있을 수 있고 아나필락시 쇼크로 인해서 산소가 또 필요한 환자들이 있기 때문에 안에서 기본적인 처치를 하고 저희 구차를 탑승해서 응급실로 이송을 하는데요.
네, so some of the allergic reactions make people have difficulty breathing. So, like this is the stretcher where the patients will be put on, and
그 심정지 환자들, CPR 환자들 그 심실 자동 재세동.
And that's the AED or the defibrillator for people who need CPR.
그리고 이거는 호흡곤란 환자들한테 산소를 줄 수 있는 산소 투여 장치고요.
And that's the respirator to give more oxygen to the patients.
이거는 그 기본적인 구급 처치 그 낭이거든요.
And that's the first aid kit where all the general equipment is in there to perform first aid.
여기에 이렇게 다 되어 있습니다.
정말 감사합니다. 이렇게 시간 내주셔서 정말 감사합니다. 감사합니다. All right, so 네, 감사합니다. So I think the team is going to be here at the center for the foreseeable future while the vaccines are being rolled out here in South Korea. But as you can see, so many work and effort is being put into this vaccination program, and I'm really hopeful that we are finally on a path to get closer to normal here in South Korea. This has been Chun Sung-cho reporting live, and back to Sunny in the studio.
All right, Song-cho, as always, thank you for that coverage. Right, neighboring China has reportedly brought the pandemic under relative control with mostly single-digit infections involving overseas arrivals. For more on the situation there, I have Dr. Samsuria Murad live on the line. Welcome back, Dr. Murad.
Thank you very much. Thank you.
Dr. Murad, I hear there has been a bit of controversy. Well, actually, I'll get into that later. First, though, there have been no COVID-19 cases in mainland China, and the very few cases that have been recorded are those involving travelers from abroad. Can you tell us more about this first?
Yeah, that's actually right. The situation now here in China is quite stable. But it's not fully recovered. We still have cases like overseas cases, and we still have some asymptomatic cases around. But compared to the last few months, so it's quite better now. And there are actually two factors which is responsible for this stability. The first one is the preventive measures. People still follow the precautionary measures. And the second, vaccination, because vaccination, that's also playing a great role in it. So that's the stability of China, and yeah.
I see. Dr. Murad, now I'm going to ask you, there was a bit of controversy regarding a COVID-19 testing method that China has insisted on using. Can you tell us a bit about this testing method?
Oh, yeah, sure. I know it's about anal swab testing, and I don't know, actually, this issue got unnecessary attention, which was not that important, actually, but some countries and some media cells, they tried to highlight it very much. The stool test was actually recommended last year, if we check the history of this pandemic. So there is something new. And another thing, so I want to make it clear that in China, it's not necessary, it's not must that everybody should do that anal swab testing. This is the first thing. It's not important for everyone. It's not necessary for everyone. But there are some facts, like the research and then officials, they agreed from different countries, from different medical officials, they agreed that, yeah, this virus lives longer in excrement or maybe or in anus compared to the respiratory tract. So this is also a fact. So I don't know why this issue being highlighted, and maybe some people thought it's a disrespect or maybe some ego issues, but there's nothing wrong with that, because the stool test was recommended last year when the pandemic hit. So that's quite normal.
I see. Dr. Murad, speaking as a medical expert yourself, would you say the anal swab testing is more accurate then?
Absolutely, absolutely. Because why China started this testing? Because first they tried on a selective group. It's around 1,000 people. Some were from high-risk areas, some were in quarantine, and some were overseas, and also some foreigners were there, right? So the patients in quarantine, actually, they were supposed to go back. When they did their nasal and throat swabs, so they were like, okay, negative, no problem with that. But when they did the anal swab testing, so they found out that, yeah, they're positive. So that was the main reason since that time. So the process is quite simple process, 10 to 15 seconds process. First, you need to do the stool test. If the stool test can't be obtained, so after that, you need to do the anal swab test.
I see. Dr. Murad,
so that's the whole process,
I see. You mentioned China's vaccination campaign. How is that progressing?
Actually, it's going very well, more than the expectations. Till now, almost 52.5 million people have been vaccinated. And that's the reason earlier I explained that this is the main factor on this stable situation in China these days. So that's going quite brilliantly, actually.
Dr. Murad, what can you tell us about the efficacy of the Chinese vaccine?
If we talk about the efficacy, so I guess the Chinese vaccine has been, when it was on the third phase, on the trial phases, so at the time we evidenced the efficacy of this vaccine, the Chinese vaccine. And it's not only China, many other nations and countries, they already approved it. So this is something like, if we are going to compare it with other vaccines, so I guess it's quite early now to judge or maybe to claim that which one is better. It's still very early, and for that, we still need some time. We will take some time for that. But it's doing great, yeah.
I see. And how are authorities there responding to cases of post-inoculation adverse reactions, Dr. Murad?
Yeah, I heard about some side effects and adverse reactions in other countries, but luckily, we didn't get any kind of severe side effects or adverse reactions or deaths. So here in China, we only faced some common side effects, like very common swellings, pain, fever, chills. So these are quite common and it's quite treatable. But luckily, till now, there are no official reports of some severe kind of adverse reactions or maybe deaths which are related to COVID vaccine. So we don't have any kind of information about that till now.
I see. Meanwhile, Dr. Murad, I believe China is now offering its vaccinated people a certificate for cross-border travel. How is the medical sector there responding to this new initiative?
Yeah, the vaccine passport, actually, I don't think so that that's something new for China or maybe for the Chinese people. Because since the pandemic hit here, so since that time, we are having these technologies like our health QR codes. So it's the same technology because we do have, even personally, I have my health QR code and which authorities are unable to check out my personal information, my health conditions, and my travel situation, whether I travel somewhere or not. So the vaccine passport is almost the same thing. That's also consists of one QR code, and which will be enabled. The authorities will be enabled to see your health conditions and health history. So that's it. Nothing new. Yeah.
I see. Okay, Dr. Murad, as always, thank you for your time and your thoughts.
Thank you very much. Thank you.
먼저 19세에서 39세 사이에는 피로감이 44%로 가장 많았고 40에서 59세 사이에도 피로감이 58%로 나타났습니다. 그러나 60세 이상의 경우에는 호흡 곤란이 58%로 후유증의 증상 중에 가장 많았습니다.
And I'm happy to say that yesterday there was the first in what will be a series of research opportunity announcements released for NIH initiative on this puzzling syndrome.
We are entering our second-year battle against the pandemic, and in today's session, we explore the long-lasting impact of the coronavirus infection that appears to affect a person's breathing, his or her brain, heart, kidney, liver, and even skin. I have Dr. Alice Hyungyong-dan from Ms. Medi Women's Hospital. Welcome back, Dr. Dan.
Thank you for having me.
And I also have Professor Chung Sun-jae from Yonsei University. Good to see you again, Professor Chung.
Good afternoon, Sunny.
Meanwhile, joining this talk virtually is Dr. AvindraNath of the National Institutes of Health over in the US. Pleasure to have you with us, Dr. Nath.
Thank you for having me on your show.
Right, Dr. Tan, some experts have warned that post-COVID-19 syndrome may trigger a pandemic of its own. Now, let's start with this grave warning and perhaps the reasons behind it.
Right, so when we're talking about pandemic because of post-acute COVID syndrome, we're just concerned because the huge impact that this disease, this syndrome might have on public health, both globally and regionally, the impact that it will have on individual health, the impact that it will have on society, and then also the impact due to increased demand for medical resources in different regions. First of all, the scale of this is anticipated to be huge. I mean, hundreds of thousands, if not millions of people may be affected by post-acute COVID syndrome. Here in Korea alone, right now we have more than 85,000 people who have survived COVID-19. By the time we reach herd immunity, this number will surely surpass 100,000 if only 10% of the survivors have some long-term sequelae. We're looking at 10,000 people who will need to seek medical care because of this condition. And so the impact on public health will be huge. Also, because of the severity of the symptoms and just the widespread nature of these symptoms, the impact on the individual is also going to be great. As you mentioned, the brain, heart, lungs, the immune system, possibly the blood vessels throughout the body, these could all be affected long term, and so that's also a concern. These can lead to very debilitating conditions for the individual. And when we look as a society, more than 60% of the people infected in our country are falling in the age bracket between age 20 and 59. These are the most active people in society. And if you consider that they will have a debilitating condition for who knows how long, we don't know the duration of this, that is concerning. And then lastly, of course, the demand on healthcare resources. What's emerging is that the best way to manage this condition is going to be a multidisciplinary approach because we do not know a cure. We don't have a single pill that we can give the person to make everything go away. And so multiple departments will need to be accessed, including psychosocial care, rehab, perhaps referral to a cardiologist, pulmonologist, neurologist as well. And so the need for more medical resources will be higher. And so that's why there is a big concern.
Indeed. Dr. Nath, the US accounts for the highest number of COVID-19 infections. Having said that, I would believe interest in the lingering effects of the coronavirus infection is quite high there. Do you agree, Dr. Nath?
Yes, I agree. So just as was mentioned, it's a huge problem, and 10% is probably a reasonable number to expect after 6 months post-infection. And there are two types of individuals. The first type is individuals who are in the ICU, and then they come out and they have multi-organ involvement, so they have lingering effects from that. And then there are the second type of individuals who had relatively mild infections in the acute phase, and then a few weeks later, they develop new symptoms. And these new symptoms can be broadly categorized into three types of findings. One is mainly memory or cognitive problems. The second is they talk about intractable fatigue or exercise intolerance, whereby if they take a flight of stairs, they can get totally wiped out for the rest of the day. In fact, I talked to one cardiologist recently, and she said that she can't even do telemedicine any longer, because if she walks for a little while, and she's just totally wiped out.
I see.
And then there's a third category of individuals who have autonomic dysfunction. So they complain of every time they stand up, their heart rate goes really fast, or their blood pressure drops and they become dizzy. And then there's overlap between all three of them. Some complain of difficulty with sleep problems, some have chest pain or tightness around their chest. But the problem with all these patients is that extensive investigation doesn't really reveal much. And so that's where I think our failure exists, and we really need to study these patients in order to understand their disease and develop treatments.
I see. That's a quite disturbing reality, though. Professor Zhang, what are some of the long-term symptoms of COVID-19 that have been reported here on the local front?
Well, actually, it's in the Korean side, too. Like Dr. Nath said, we had very similar symptoms reported also, like the memory loss or the fatigue or like AES symptoms. And also, we have the common symptoms reported like from China, like fatigue, dyspnea, cough, arthralgia or chest pain, and maybe loss of smell or taste sensation, and also some complain about the chest discomfort or loss of hair. And sometimes, well, there are some concerns about brain fog. And they say is that they have a headache and they are like having a subjective memory problem and depressive mood too. So, well, I think we are having kind of similar the symptoms from after the COVID-19 infection, and also from the China. Well, it is said that about 1,700 people were followed after their infection, and 76% have reported that they have one more symptom reported, such as fatigue, and a quarter of them have reported about the depression and sleep disturbance, which is quite a lot. And I guess these symptoms can remain like 6 months to 9 months from the previous reports, and we are worried about this longer-term effect from it.
Right. And just out of curiosity, Dr. Dan, how do these lasting physical problems of COVID-19 compare to those of other illnesses, if there are any?
Right, so the public may not be aware, but there are certainly other infectious diseases that have not just the acute phase, but chronic phases. Here in Korea, we might be most familiar with hepatitis B. So there's definitely an acute phase, and then there are chronic phases as well. Hepatitis B can lead also to liver cirrhosis and even liver cancer. There's another virus called Epstein-Barr Virus Ebv. It's a ubiquitous virus. Up to 95% of people will be exposed to it. In adolescents, when they get EBV, it's a condition called infectious mononucleosis. So they get high fever, swollen lymph nodes. Their liver and spleen can enlarge as well. But Epstein-Barr can also lead to cancers, nasopharyngeal cancer, B-cell lymphoma. And then there's this rare form of Epstein-Barr called chronic active Epstein-Barr virus. And in this condition, the virus actually stays alive in our body in immune cells, such as B cells, T cells, NK cells. And it can lead to problems in the liver, in the brain, in the heart, in the lungs, in the blood cells. And so certainly there are other examples of diseases that have chronic forms, not just hepatitis B, Epstein-Barr, Ebola, strep throat as well. So it is possible. We just need to investigate what's going on with COVID-19 more.
Right, and speaking about investigating now, Dr. Nath, I believe you are currently involved in an extensive study on how COVID-19 affects brain tissue and then leads to long-term repercussions of the virus, such as brain fog, which is something Professor Zhang mentioned earlier. Please tell us a bit about your study.
Yeah, so we have actually 3 ongoing studies. One is an autopsy study, whereby we've looked at the brains of individuals who died of COVID. We looked at a very unique population. These individuals had died suddenly. They had very and minor respiratory problems, not enough to even be seen by a physician. But however, they were found dead in their bed at home or in a nursing home. One was found dead in a subway. Another one was just playing with his sister and just fell down dead. When we looked at their brains, we were very surprised. There was a lot of pathology in the brain. We found the blood vessels were leaky. We found there were lymphocytes and macrophages in the brain. And we found that some of the neurons were degenerating in different areas of the brain. So that to us was quite concerning because these individuals, had they not died, they would have survived. My guess is this kind of pathology would lead to long-term effects.
I see.
So the second study that we have is now we're bringing in patients with any kind of neurological complication that they might have. So we want to try and understand how and why that is happening. The third study is a subset of individuals who have these long-term effects, but they resemble a disease called myalgic encephalomyelitis or chronic fatigue syndrome. And so this is a syndrome that's existed for a long period of time. Nobody knows what the pathophysiology is and how to treat these patients. But most often they're triggered by some virus, and nobody knows what the virus usually is. Here we have an excellent opportunity to study this chronic fatigue syndrome because we know what the virus is, and the symptoms are very similar to this other disease. So we're bringing in those individuals, and we're going to study them very extensively, admit them for several days in the hospital, do all kinds of MRI scans, look at their spinal fluid, their lymphocytes, and look at their nerve and muscle biopsies, also skin manifestations. So our hope is to be able to identify the underlying pathophysiological processes. And as mentioned earlier, there are two major prevailing hypotheses. One is that either there's persistent virus or restricted viral replication in these individuals. They may not be producing infectious virus, but bits and pieces of the virus could be stuck in various organ systems. The second possibility is there's no virus any longer, but instead what you're seeing is a persistent immune activation. And so that could be driving the pathology. So we're interested in trying to look at these things so that, because the most important thing is to start clinical trials as soon as possible.
I see.
So our hope is that we can start looking at these patients and then initiate clinical trials to be able to manage these patients.
Right. Dr. Nath, do correct me if I'm wrong, but earlier on you spoke about neurons degenerating and then this leading to potential long-term effects had the patient survived. What kind of long-term effects are you talking about?
Well, it depends on the area that is involved, right? So, for example, if areas in the hippocampus or the temporal lobe are involved, then all kinds of memory problems are going to occur. There's a nucleus called the amygdala. If that gets involved, then all the emotional problems can occur, apathy, anxiety, depression. If the brainstem gets involved, then there could be difficulty with swallowing or breathing problems can occur. A lot of those centers exist in the brainstem.
I see.
If it's the olfactory bulb, then permanent smelling problems could occur. So so it just depends on what areas get involved.
So is there a possibility of potential long-term memory loss?
Some patients are complaining about that. So these so-called long-haul patients, some of them complain of difficulty remembering things. It's an interesting type of memory loss that they complain of. They complain of dissociation of time, whereby they can remember, for example, what they ate the day before, but they can't remember when they ate it. Was it a week ago or was it yesterday? So others have a lot of word-finding difficulties. And then some have short-term memory loss. So it's a very unique type of cognitive problems that these patients are complaining of.
Right. Professor Chung, what can you tell us about the psychological impact of living with long COVID? I can only assume that it would be tremendous.
Well, actually, yes, because from the beginning, we were worried about these mental health issues from the COVID-19 epidemic. And actually, we had like 15% of the people having kind of anxiety disorder, which is clinically relevant in the level. And also, for example, we don't have any kind of aftermath data after COVID-19. However, we have data from MERS outbreak in 2015 from our past history. And when this Korean CDC has followed the survivors from the MERS outbreak, and it was after 1 year, they still had like 35% had the lasting PTSD symptoms and sleeping problems too. So, and also they had a relatively higher rate of suicidal thought, aggressiveness, or phobia or depression. So, and I think it can be also explained by this amygdala or brain inflammation also, but it can be also be affected by the psychological effect because this COVID-19 and also the MERS outbreak, they were both the newly emerged disease without the exact treatment, and they had also the high social stigma. So it could be like affected by the psychosocial factors. So I think in the future, it needs future monitoring for the population mental health very carefully for this kind of problems.
Right, and having said that, Dr. Nath, please do share with us the efforts in the US to better treat those suffering from post-COVID-19 symptoms.
So currently, there is no direct treatment. I think most of the treatment is supportive. So just as was mentioned, the most important thing is first to find out that these patients don't have some other underlying illness that could explain their symptoms. It's quite possible maybe they have underlying diabetes or some other immune condition. So that's the first thing to do. Then the second thing is to make sure they don't have some kind of end organ damage that may have occurred from the infection itself. And once those two are ruled out, then the next thing is you provide supportive management. So as just was mentioned, rehabilitation efforts, symptomatic treatment of depression, and if they have autonomic dysfunction, then there are a number of things one can do, like mineralocorticoids and treatment of the heart rate problems with various kinds of beta blockers and such. So there are a number of things that can be done, but what we really need to get at is trying to understand if there's persistent virus, immune activation, then one can give more directed treatment. And so that, I think, is not currently available, but hopefully soon we'll be able to sort it out.
Right. And Dr. Dan, where does Korea stand with regard to efforts to treat long COVID?
Well, I think this is one area that we can work better on. First of all, we need to assess the need for treating post-acute COVID syndrome. And there are some studies ongoing, so research is ongoing, but they have been sort of small in scale. So our National Institutes of Health is teamed up with the National Medical Center, and they are following a relatively small cohort of 40 adults every 3 months with an examination and also a survey just to see how they're going. But 40 adults, that's a very small cohort compared to how many people have actually been affected. In terms of treatment, unfortunately, we do not have a formal protocol yet, and we don't have a formal referral system. So even though we have very aggressive testing and tracing and monitored isolation for 100% of diagnosed patients, after they're released from isolation, we don't have a follow-up system in the ambulatory care department for them to go to for follow-up care. Perhaps we could adopt a system that Johns Hopkins Hospital is using. They have a post-acute COVID team, PACT, and that's a system where they can give very compassionate, multidisciplinary care along the continuum of this syndrome. And I think that's something that perhaps we can implement into our healthcare system as well.
Hopefully in the near future then. Moving on to vaccination, Professor Chung, a recent report by US health authorities claimed that women experience more side effects related to vaccination than their male counterparts. I believe you were recently vaccinated. You received your first shot.
Yes, I got the shot.
How do you feel?
Well, I'm okay.
And
right now.
then what now are your thoughts on this report?
Well, actually, we have to think about this measurements bias always, because I always have the reporting bias. In this gender difference you are reporting, in the reporting, usually most of the time women try to seek more medical institutions, the assessment and treatment when they have the problem. So sometimes, I mean like most of the times, women have a high report rate of this physical problems. And the other thing is that there were also similar results from the other vaccines, like the vaccines for the influenza, hepatitis B, or the measles. Women also showed a higher rate of this adverse event. And I think biologically we can explain that women actually have the relatively low the body surface area per one dose of vaccine. And also this female hormones such as estrogen can make this enhance the higher immunological response for that. But I'm not sure that this difference is significant. However, well, back to my own experience, well, I got a shot on this Monday, and well, at that time I was okay, and then I just felt a little bit of the heart throbbing. However, it just disappeared within the 5 seconds. And then in the second day, I felt a little bit fatigue and nausea in the morning, but I could still do my worst. And then I just had my Tylenol one tablet, and then it was okay. And then the third day, I was totally okay. So for me, I didn't have that kind of gender differences for the adverse event. However, I told that my junior residents, regardless of gender, they had a higher rate of this common adverse symptoms such as fever, myalgia, and fatigue. And they suffered maybe in the second day most, but they got the Tylenol or the analgesics and they were okay on the third day. So I think maybe gender can matter. However, I think age also matters. Like the younger generation, they can have more this kind of frequency of the adverse event.
I see. And right then, Professor Chung, as always, thank you very much for your thoughts. And Dr. Tan, thank you for being with us. And Dr. Nath over in the US, thank you very much for your insights and your time.
It was such a pleasure being on your show. Thank you for having me.
Right then, it's time to end our coverage for this week. Do remember that social distancing guidelines have been extended for 2 more weeks here in Korea starting next week. Have a safe weekend and see you on Monday.